Spacers, yes, of course. Spacers. I think you're originate tunafaa kuwaita, sindio, as our audience. Like I feel kunafaa kuwa tuna kawad flani. Right? So spacers it is. Welcome to yet another amazing episode ya Space Yako, of course. Hapa ndio unatupata weekly and majina kamili Aisha Njikule Malkia Kizazi Kipya, and I am joined with my girlies. Semeni majina raka.
Hi, I'm Marley.
Gladwell here.
And of course, we have our special guest with us today. And you can come Daktari Claire Gadhoni Kinuthia. Excuse me. Unapata hizo majina zote? Dr. Claire Gadhoni Kinuthia. She's an OBGYN. Okay. Alafu pia, she has an amazing podcast ambayo inajulikana kama Circling the Rabbit Hole. Yes. Anafanya mambo mengi sana. So on a day-to-day, kama unamtaka for consultancy, unampata Upper Hill. Atatuambia where exactly in Upper Hill. And she's just an advocate for sexual health in general. Mengine mengi, she's here to tell us. Hi, Claire.
Hi.
Oh, Dr. Claire.
I'm very excited to be here.
Yes?
Yeah, I love the energy with you guys.
So let me take it back again. I want to feel the energy. Hi, Dr. Claire.
Hi.
That's better. We love it. So, wow. How are you feeling?
Good.
Yeah?
Excited to be here.
Yeah.
Excited for the conversation we're going to have. Mm-hmm. Yeah, because I feel like we have so much to discuss. I love that young women are more interested in their bodies and having candid conversations and being a bit more open. So let's do it.
So ukituangalia hivi tunaka potential customers.
Kabisa. In fact.
We all look like potential clients to you
Immediately.
Today. So we want to start the episode differently, okay? So tuko na hizi cards zetu za Wazi. But then let me highlight you real quick about Wazi. Wazi is a chatbot. Unaenda pale kama kuna maswali yote ya sexual health, love, relationships, please, it's a chatbot. So nataka uchukue simu yako, ukienda pale katika website which is wazi.ke. Unaenda and chat, say idea, hi, hello, hola, bonjour. Chat with it, alafu unajua ita prompt different messages. So just have fun with it, okay? Actually, we're supposed to have some incentives for that, right?
Yeah.
Do that, send us screenshots. Hashtag ambao unatumia ni Space Yako the podcast. Alafu tuona vile tutakujenga, sawa? Just experience, just have a good experience with it. Pia kama huwezi kwenda pale katika website, kama huna bundles usijali, manake kama kuna credit, basi unachukua simu yako, you dial *709# and that is the USSD code. Hivyo tu pia sema hi dear, hi niaje mpoa wangu. Okay, sijukaita reply ukimwita mpoa. But just know it's a chatbot. Alafu pia across our socials unatupata, that is Wazi as well. WAZZII. So tunaanza with our Wazi cards. So daktari, nataka wendo wanze wa kwanza. So just pick a card and then we flow with it, you know?
Yeah. Ukiuliza doctor a question, atakujudge.
I think
Halfway kukujudge.
I think from facial expressions zingine madaktari huwa mnatubeba wana. You might not tell us directly, but umeuliza so nimekuwa nikisikia hapa hivi, and then they look at you like,
So you feel like we judge you?
yes.
Yeah. Because the silence was loud. That's
I was like, because she's here representing the doctor expert. Making one, put myself into trouble. But speaking from experience and as a young person, have I felt judged? Yes, several times. And the judgment comes with the feel of when I want to access different services. I have not particularly gone in a facility to access maybe contraceptives. But just issues with the reproductive health.
Yeah.
And because I also have a journey with seeing now specialists like a gynae and all that. But just in a general hospital. You saw that meme ya wewe wa kisonono ingia huko. Mimi sio ya wa kisonono. Yeah. But it's like such videos really intimidate. And even from my personal experience, you're trying to explain to someone something because you're the one who is experiencing that. But yeye hapo ako like, haiwezi fanya hivyo, haiwezi kwa hivyo. And you feel like, why is this person mbona ananipin kwa corner ni fit criteria yake, how they want me to feel, how they want me to explain myself. So have I felt judged? I have several times. Yeah.
As for me, I haven't been judged, but naizongelela from a friend's perspective. alikuwa ameenda for should I say consultation? Wacha niite consultation. So ni ile the question ama vile tu aliphrase the tumite service provider alikuwa anamwambia ati why are you even having sex in the first place? So kuna wenye wanakujudge wanasema huyu mdogo hivi tayari anaenda kwa anafanya tu vitu vyake.
My God, those are the eyes I used to get, like the stares from the nurses and the doctors. Because I had my child when I was 20.
Right, yeah.
Hey, so
you
I
were
was
really
way
young.
smaller than I am right now.
Yeah. So
So
you're walking
nenda
in
huko
and
anakuangalia na shanga sasa huyu. Honestly, kuna daktari mwingine aliniambia sasa wewe, mimi ni wa Mombasa, can talk in Swahili. Like sasa wewe mwenyewe mtoto alafu uko umepata mtoto. God, I remember that line because it was so, I felt that it was so mean.
Yeah.
But the reality is your stories are not like unique. That's unfortunately the way a lot of places are and a lot of the service providers. And it's just because of the way we are trained. It's sort of like old school, that old school mentality. We're working on it. The younger doctors are much better. I have to say that for free, but the training needs to happen.
Okay, so you can do the next card?
We can, okay. So this one, ni must ushave before uishe hosi. True or false? Ebu ongeeni mtuambie.
Bro, mimi nakuja vile niko. Kama ni mkeo asubuhi, it's a bush down there. You're gonna get a bush down there. Nitakuja tu hapo Dr. Clown like, bro, twende nalo.
I've just remembered. Because now later, like not even guy, mbona naongea nikawa ni mzee, but like after now trying to seek, because I had a reproductive health issue, and after trying to seek services in public hospitals because I was advised they give the best. It came to a point where I was just like, no. I feel like I'm not being given the service that I want. And now I had to like make your step ya kwenda kwa gynae and all. And so I was, because like I expected to find a woman, because in my mind, even with the sexual and reproductive health knowledge that I have, I was like, women specialize in this, you know. And then I opened the door and it's a man. Nah. Karura Forest was Karura. So, okay, it was not that bad. But again, it didn't click to me because at that time I was in pain. I just wanted to get the service. Na kufungua mlango nimepata kiti, baba kimeka kwa kiti. And they have to check, apparently.
But you're feeling uncomfortable.
I was really, uncomfortable is not even the word for it. Like, sikukuwa nataka. I wished ninge turn back, but nikikumbuka pesa nimelipa ya consultation. Hata tu. Atanitoa wapi? Atanitoa wapi? And I said, so, I think I had the insecurities. The doctor did not show me. Like, the gynae did not show me kama alikuwa uncomfortable or not. But kwangu mimi, ata wakieka, like, the liquid and all, because I went for an ultrasound and all
gel.
That. Wakieka the gel ama touch the vulva in it. Nilikuwa like, oh my God. You know? So I was uncomfortable, but daktari hakunionyesha.
Do you shave when you see another gynae?
Your doctor doesn't care. Your doctor doesn't care. Remember, us, we learn the body as is. So they're the fancy things that you do, maybe it's for you and your partner. Your doctor just doesn't care. Sometimes you surprise us and they'll be like bedazzling and bejeweling. But your doctor generally just doesn't care. It's not something, when I'm examining you, I'm examining for certain things. Does this look normal? Is there any swelling? Is there any obvious discharge? Is there any redness? Those kind of things. So that's where your doctor's mind is. I will not remember in the next few minutes that you had shaved or not. I promise you. And then remember how many patients we see in a day. You also have to remember that. So vile ulisema hata kupata mahali, honestly ukitoka hiyo mlango, honestly, I'll finish my notes and we move to the next. So it's not something that will stand out.
Let's do the next card. That is mine.
Okay.
Ukiwa na pubic hair, we ni mchafu. True or false?
Mbona mimi?
That is false. Hiyo ni false.
Okay, let me ask you something. Mali nataka nimwangalie. Ukiwa na pubic hair, we ni mchafu. True or false?
False.
That's false.
To me it depends. And not me saying that like nimesema tu nilienda kwa gynae venye nilikuwa nataka. But I think it depends also if you clean it, because hair puts a lot of moisture on skin.
Yeah.
So to me, I'd be like, if you clean it well, that is okay. But kama ni ile umeenda kwa daktari na anafaa move through bushes in their afike destination, and it's not well cleaned, then I think there is a problem.
But Asha Sema, they don't care.
Yeah, but I'm like, personal hygiene for me,
For you.
I even if it's not shaved, like I just ensure ni safi, like well. So kuna watu wanaweza kuwa na pubic hair and they don't clean them well, like
They don't
the
wash
area
well.
yeah. So then there I'll be like, yeah.
Daktari?
So like she said, it's about your personal hygiene. It's not about whether you shave or not. You don't look at someone and say, Haja shave, so they're dirty. It's not like that. So are you cleaning yourself properly? Do you know how to clean yourself when there's hair? Like you've said correctly, the hair sort of collects and pulls dirt away from the rest of the body. So you have to clean the hair properly. So it's not a thing that you have to shave so that nikwe msafi. That's not
So you just blow
necessary.
dry, guys, blow dry, make sure straighten. That's what Daktari is saying, right? Malin, ya mwisho tuanze topic. Acha tuje introduce topic yetu.
Bad.
Okay, this is my so true or false. And by the way, guys, they forgot to mention these are wazi cards. Ziko na our wazi logo over there. So unafaa visit sexual health
Niliwaambia
clinic.
nikiwaambia kuhusu website.
Uliwaambia?
Alianzia nayo.
My apologies.
Reiterate,
So you're not paying attention in class.
My
No.
ilinipita because I was like, nataka tu kusikia kama daktari.
Hey, Malin, hebu ulize hiyo swali tuanze topic yetu.
Okay. So unafaa visit sexual health clinic time yenye kuna something wrong with you peke yake.
No. General checkup.
Hata mimi feel like nakusupport too.
General.
In general too.
As a young person, 4K ni consultation.
Yeah.
But I agree, there are like public facilities that are maybe free, though I don't know if they offer like really the kind of service for reproductive health, like the checkup and everything. But yeah, I think people should invest and do checkups.
Waende frequently.
Sisi watu.
Sisi, ni kina sisi.
Ni sisi.
Tunajiongelelea.
Sisi, as your potential client,
Yeah.
should we come only when we have something wrong?
Malin, I have a question for you. Just a standard question. How much do you spend on your personal hygiene products per
Okay,
month?
that is-
For example, just think about give me a figure. Like your lotions, sabuni, toothpaste, those kind of things.
To be honest, as a young person, first of all, when I go in the market, I'm looking at prices.
Best.
Yeah. Sasa hata kwa sabuni, I won't talk because it's like, kama kuna menengai, that is what I'm going to use. Kama hiyo siku ni mafuta ya ng'ombe, that is what I'll use. So I'd say maybe 2,000 maximum.
Okay.
Yeah.
But the point is, you will never skip personal hygiene. You understand? Huwezi sema ati sina do, sitanunua sabuni nisioge. Sindio?
Yeah.
So the way we look at health, we look at it like it's postponable. Because I'm young and I'm not feeling pain and I'm okay, ni sawa, I don't need to see a doctor. Shida ni, by the time you come to see us, sometimes you have such bad complications because umeshinda ukipostpone an issue. And yet you're not looking at it as healthcare is an investment, so that when I'm older, already I know my body, I understand my daily functions, kila kitu iko normal. Daktari nimemwona, and we only ask you to come once a year. It's not many times.
Really?
Your general checkup with a gynae is once a year. So it's not something that I need to see you every week or every month. As long as it's outside of pregnancy, your checkup is once a year routinely. And beyond that, so when you start saying, daktari ni expensive, what happens? Because we can miss a problem that by the time you come, you're going to be spending thousands in hospital for surgery that maybe would have dealt with earlier. Yeah. So I like people to change that mindset. There's some things kila mwezi, I need food, I need this. Then put some money away, pay for insurance, and make sure you see your doctor at least once a year.
Alrighty, tumeongea sana lakini angalia mambo yote ambayo tumeongelea, it's in line with our topic of the day, alright?
Yeah.
So msidhani tu hapa is just conversations free flow. No. So today we were supposed to discuss body and sexual health. But before that, we always start with Space Spice.
Right, okay.
And Gladwell is the one to do it for us today.
So today I shall kickstart the Space by segment with all of you. Higher. Did you know that the clitoris has over 8,000 nerve endings, making it one of the most sensitive parts of the human body? So for comparison, we do have that each fingertip, your fingers upper, each fingertip has about 3,000 touch receptors, many of which respond primarily to pressure. Now, the citations being secondmedic.com and myclinic.com.sa. So, yeah, mnaweza enda bado muangalie hapo. So, hiyo space mnaiona je? Mlikuwa mnajua kwamba the
8,000.
clitoris iko na vendings mingi hivyo?
8,000.
Imagine.
Meaning it's very sensitive.
8,000.
Let me talk to the man real quick. Mkitusugua hivi mnataka nini? Bruh, it's you barely just touch it like this.
Unagonga ngumu.
Mwache kusugua kama ni sufuria. 8,000.
I'm like, uliona ile mimia. Kuna dem lazima ugonge ngumi ndio igonge.
And it has 8,000.
8,000.
Bruh.
Imagine.
Usisugue kitu kwa sufuria. Sio daktari.
Ukweli.
Wewe unataka hivyo nini?
You'll be caused injuries.
Na blisters. Hatutaki hiyo maneno.
Is that true though, scientifically?
Yes, it is. It's the most innervated area of the human body, both male and female, because it's a smaller organ than, when you think about our development, the clitoris and the glans, which is the man's organ, the penis, the clitoris, they come from the same origin. But you can imagine size-wise. So that concentration of nerves that you would see in the penile organ is all concentrated in a
The
smaller.
cleats as well.
Yeah.
So it's 8,000.
Yeah.
Ah, okay.
Kuna ile ukweli haigongangi, labda igongwe ngumi. Like, are there nerves that don't work? That is what I'm trying to ask.
Failed nerves.
I would say there are no people who have nerves that don't work. They're more likely that you don't know how the nerves in your body work.
Oh. So there is a way to like
Don't
grab.
understand, yeah. You need to learn and understand how your body works.
And does the sensitivity ukiendelea kuwa mkubwa, like inaende ki-reduce ama itabaki tu standard? Like tuseme like as of now vile tumesema the clitoris has 8,000 endings. So your functional yake ya kufeel your pleasure itakuwa the same nikiwa maybe 40 years old.
Itakuwa the same. The organ itself haitabadilika. It's again, we know women are very, very sensitive.
Yeah.
So it's your mentality. It's whether you're
It's
stressed
mental.
out. It's whether your hormones are
mental.
okay. But the organ itself, the structure doesn't change.
Doesn't change.
Oh, unadhani yani paia it's minus 1,000.
Ninadhani ukiendelea
Like happy birthday.
Yeah.
Like I now have 7,000 nerves on my clitoris.
I have 1,000.
In fact, for young women, I'd like
Zimefika ngapi?
Why 8,000?
for young women, in fact, it's very good news. Our sexual peak is in our 40s.
Oh.
So you have a lot to look for.
Let me tell you something. Let me tell you something, Kinuthia.
With how I
In
feel
my
now.
30s.
Right? It
Yeah,
gets
it's
better in your
something.
40s.
Okay.
Yeah.
It gets better in your 40s.
Are you looking forward to that?
Yeah.
Oh, nice.
Yeah.
I love it here because we can talk about anything. Anyway, so nataka kuuliza daktari, OBGYN anafanya nini? Huyo ni nani anafanya nini?
Okay, so it's 2 doctors in one.
Okay.
Training need 2 doctors in one. Obstetrician, I know they're big words. Obstetrician, gynecologist. Obstetrician, I'm your doctor in pregnancy. So during pregnancy, your gynae becomes your obstetrician. And the job of the obstetrician is 2 patients, the mom and the baby or babies. So that's why it's a different title. So you're looking after both mom and babies throughout the pregnancy. And then ensuring a safe delivery, ensuring a full recovery after delivery.
Oh, that's nice.
When you get to 6 weeks after delivery, I go back to being your gynecologist. So a gynae is women's reproductive health. So you will always transition. You can have the same OBGYN from when you're very young and transition into pregnancy,
Yes,
later
to a
into
woman.
life, your womanhood, and then later into perimenopause and menopause. It can be the same doctor looking after you.
Yeah.
Yeah.
So you walk with us throughout our
Throughout the
milestones
journey.
as,
Yeah.
you know, from a young
We
age.
become family. When you have your gynae, we become family.
Hey, unakaa hivi unalala una like ile vulva isha leo. Wait,
Sikumbuki.
let me ask you something very like it's very stupid. Msini judge like.
Tumejudge.
Tumesema hapa to judge us.
Hey, this is a judgment-free zone.
Let me tell you.
Proceed there.
With my work, so let's say Jules ametuambia mwende musome kesho mnafanya hii episode. So I might get an idea in the middle of the night. I'm like, but this tunaweza fanya hivi. So after seeing your patients, do you dream about, do you have like those dreams?
I will find
Like, do
myself.
you see just someone's care and blah, blah?
No, not like that. Usually we will, like for me, if I speak for myself, I'll sit with someone whose case is either complicated or confusing to decide how to treat them the best way.
treatments.
So we'll go home, research, read some more, consult with colleagues, create a team around the person.
Yeah.
That's where my head will be. If I have a very complicated patient, if there's someone who is very sick in hospital, I'm going home to prepare myself
treatment.
to make sure their treatment plan is taken care of throughout.
nice.
Okay, and if I may ask, because I think we've jumped into patients, and sisi kama potential buyers, customers,
Yeah. Kina
do you
sisi.
think that because our laws bound us to accessing information on sexual and reproductive health as well as services, do you think there is a specific age that someone can walk into your office or anyone can?
So there's no age limit. We usually advise that if you're healthy, you've not had any issues, probably start seeing your gynae from around age 11. That should be when we start, because remember now again, the advantages of the youth. You now have the HPV vaccine, the human papilloma vaccine, and it's supposed to be given much earlier. And your gynae is one of the places that you can get the vaccination. And also, like I said, your gynae is your safe space. That's where you can go and get sexual education, you can get reproductive health education, you can learn about your period, you can learn about managing issues around your period. So we usually will have, like personally, I have lots of moms who bring their daughters and we have a conversation together. Sex ed, because maybe she's not too comfortable or she doesn't have enough information to share with the daughter.
Yeah.
So then you come in and we have that conversation. Coming to a gynae doesn't necessarily mean utaexaminiwa. You don't have to have a problem. You can come for a conversation. Consultation means you can come and tell me there's an issue, we talk about it.
Okay.
Or you have a question. You're not necessarily needing a service, but you want to discuss a specific topic. So we start pretty early and then you'll be empowered much more as we continue. So that's the advice I'd give in general.
I remember I learned about pre-cum from my gyna. Is it gyna? I hear you say gynae.
Whichever way you pronounce
Gynae,
it.
gyna.
Because again, it's British or
Tomato.
American English. It just depends on whether you
Yeah.
put the AE or the E.
I learned about pre-cum from him.
Yeah.
I learned about it's nice to take yogurt once a week. Yeah.
Yeah, you should have probiotic yogurt.
Probiotic yogurt.
That means they have active cultures. Some brands have, some don't. You just read the package.
Good.
Yeah.
Kuna yogurt too.
Yogurt too.
Not zote. Pia cranberry juice.
Yeah.
Yeah, cranberry juice. Oof, yeah.
Pia
But I'll emphasize, because I've seen things, ni kukula na kukunywa, please. See application, see insertion.
Oh,
Sawa.
okay.
Wait,
Just to clarify.
Yeah, and speaking of that, which is of importance, I remember throughout this journey of mine with my reproductive health, kuna time because now it came to a point where I've gone to different hospitals to see different gynas, and I felt like no one was really getting where I'm coming from, you see. And so I was just consulting with friends who have been to the most high-end facilities, and they were like, me, I was told not to apply or anything. But then back here, people are like, you can apply yogurt and the bacteria.
Okay.
Yeah.
Oh,
That's why I'm
chili.
emphasizing.
Yeah. Like you can use garlic,
purpose.
you can apply yogurt, atiwe na nyonya bacteria or something.
That's what I was saying. Because now you'll do that, then you come and see me with a very bad infection. So now I have to start from scratch with clearing the infection. Think about it. Ni chakula. It's sugars, it's the fluid, it's, and then that area is supposed to be dry, clean and, so you put in something that will grow bacteria or fungal elements. And next thing you know, you come in with a very bad infection.
So now,
Wait.
let's pretend I have a man's. And he's saying he wants to use yogurt during foreplay.
Yogurt during foreplay.
Yeah.
So external, never internal.
Yeah, see, apple too kwa labias.
External, never internal.
Yeah.
That's the key.
And those people who do the strawberry dip and then...
External is fine.
Guys, msitulete ideas. Isn't it between us, Homa? Let me guess.
External, never internal.
Yeah?
Yeah.
Okay.
So what are you... So tell us, because I feel... You see, guys come with ideas. They're like, situfanye, sijui nini. But then you see, at the end of the day, as women, we're the ones who end up with these infections. Yeah?
The important message there is understand your body. Because, again, part of sex ed is understanding body autonomy and making decisions for yourself. So in a scenario like that, no one should bully you into doing something you're not comfortable with. It's part of what you need to understand. You're empowered enough that I don't feel this is good for me. It's a no. this I'm comfortable with, it's a yes. Consent is king. That's the thing we'll
Yes.
keep emphasizing.
I think we have an
Daktari.
episode for consent.
On that, I had a question. Because umesema the external, hiyo ya kuweka the whipped cream na strawberries iko sawa because it's external. Sasa mimi my question is, haita kupatia hizi infections kama yeast infection, kina bacterial, vaginosis?
Hygiene bado ni important. So mkimaliza, go and clean up
You
and
clean
wash
up
properly.
yote.
Yeah.
Okay, na vile bado ulikuwa umesema that you can be my gyna from age 11 tena nikiendelea kuwa mkubwa, let's say nimefika childbearing age ama stages and you'll switch and become my obstetrician.
Yes, yes.
So is it right to assume that kila mtu ambaye ni gyna pia ni obstetrician ama unaweza kuwa tu mmoja nikifika hiyo childbearing stage unaniambia hii iko out of my like whatever I can handle, acha ni kurefer to somebody else, maybe another obstetrician, kisha nitarudi kwako.
I think I can answer that before she answers.
It's okay.
So when I go to the office, Dr. Charles is just a gyna.
Okay.
Then there's another doctor that you see, medical OBGYN.
So it depends on training.
Right.
So if you are trained in East Africa in general as a doctor, we're trained in both because of resources. You want to get the best training with the few numbers that you have who come into med school. If you go in other, like more international countries, you can choose as the doctor, as you're training, I want to only do obstetrics, I only want to do gynecology. But in the majority setting of doctors who are trained here or doctors who are trained, because we follow the UK curriculum, you'll find that we are both. And then when you subspecialize, you find that you'll find a doctor who's a fertility specialist, another one who is urogynecology, those kind of things. So you end up with that variation. But generally speaking, most times if you go to your gynae, they'll be able to take care of you throughout.
All right. So because I felt we've addressed like general issues and in as much as we're having just a conversation, but then back to our topic.
Yeah.
Body, knowing our bodies, how does this relate to our sexual health?
It starts from understanding your body. First of all, what is normal, what looks normal, what feels normal, and then what you should be doing to keep yourself healthy. That's what we need to learn from sex ed. It's a big gap, and it's one of the things I advocate is comprehensive sex education, so that you start to understand, inanzana, this is my body, this is the right name for this part of the body, this is what this part of the body does, this is how to look after this part of the body. And that's what a big gap is, because a lot of us come in with a lot of shame. Naumwa na pale. So mimi nakuangalia nashinda wapi? Pale. Utaona. Ukiangalia utaona. I want you to check. I'm like, okay, great. But I need to understand what the issue is. So we have that shame because we don't have education around it. Then the next thing is understanding, like when puberty happens, what the changes are. The next part becomes when, yes, puberty is happening, my period starts. What is normal? What is not normal? How many days is normal? How much flow is normal? Is pain normal? You know, those kind of changes. A lot of women are affected by those things, but because we don't talk about it and nobody teaches you. In fact, a lot of girls come to me and tell me the first time I got my period, ilinishtua tu. It just started. Nobody had talked to me about it. I didn't understand pads. I didn't understand tampons, you know, those kind of things. So if that's the reality, the question we have to ask ourselves is why? That's not, it's not supposed to be the normal. When it comes to periods, why don't guys get taught about periods? Why is it only a female thing? Because when you partner up with someone, they're going to end up having to understand your body.
Your cycle.
And your cycle. So if he has no education around it, because I find, like, especially the couples I look after, the partner knows more about the lady's cycle than her. So that tends to be...
kuna mtu hapa na keep records.
So we should be teaching our boys and growing into men about the female as well as the male reproductive system. So that's where sex ed plays in. And then now we go into things like, it's time to think about whether I'm ready to be a mom or not. Do I need contraception? Do I need birth control, family planning, whichever way you like to call it? Is it relevant for me? If so, who can I talk to about the types that are available, especially in my situation? And then once I decide which method, how do I go about getting it and using it for as long as I need to? If I'm ready for a baby, how do I come off it? How do I start the journey? Because you should see your gynae before you get pregnant to get you in the best health for the pregnancy.
Yes.
Si ile ya kushtukia, now is when to look for a doctor. You should actually start before the pregnancy. Then we get into pregnancy, we look after you, delivery.
Then now you go to the OBS.
Yeah, we switch into your OBGYN. We take care of you through that journey, safe delivery, whether it's normal delivery or CS, there's really no difference. It just depends on the pregnancy itself. And then the way you grow into now your 40s, your 50s, as perimenopause is
different.
starting. Yeah, your body keeps changing. And that's the thing that I think is beautiful about being women. We're not static. Our bodies change throughout our lives.
Yeah.
So through all those changes, it's important to have someone that you can trust, that you have a relationship with throughout, so that you get accurate information.
So, do you feel the way we say, you know, as women, our partner should understand our bodies, the changes that come with it, and everything else?
Yeah.
But do you feel the reverse is also
True,
important?
yeah. Because we've always had education where we split them. We split girls and boys and we teach them separate things. And I don't understand why, because who are we interacting with?
Oh, it's
out in
because
real
the
world?
penis is just, you know, it's just the teeth and the balls.
It's much more complicated than that. You know? Yeah, it's much more complicated. And
It's
again,
just like, see, man's up, and
the good thing, okay, traditionally, the boy child, the men have had, after initiation or if they go through the ceremonies, they get educated a lot about their own bodies that time, and hygiene and what is healthy, what is not healthy. So that's a good advantage, but not everybody has that access. So it should be something that you're able to get from a very young age at home as well as in school, so that kila mtu akona your information. It's not a TV, it's being kept. You have to have access to me, this gynae, to be able to learn these things. You talked about some government facilities. Government facilities, a lot of the time, have the best services, the most affordable and the best services. That's the thing people don't know. But it depends on the county, the supplies, those kind of things. But the vast majority, if you need, for example, contraception in Kenya, is free for the most part in most government facilities. So these things, it's just we don't know. We don't talk about these things. So you'll be able to get access if you start from an early age. You know exactly what you need. You know where to go. Yeah. Yeah.
So a gynae is to women, and a dash is to men.
Urologist.
Urologist.
You or new?
You.
Or
Urologist.
Yeah, it's to men.
Urologist.
Yeah.
Do you normally get patients who come with their other partners? Say you're dealing with female patients, and then a gent is accompanying the lady in order to know whatever session that you.
Yeah. Tends to be that the partner will come in if we're talking about contraception or if we're in pregnancy. That's the time we see them a lot. The rest of the time mnaambiwa endeni muone daktari.
But you'd recommend that they should be there for all
I
sessions.
always recommend that you should come in together, because if there's an issue, especially when there's an issue, how else will you understand what's happening with your partner? You'll get surprised and shocked, and then you don't know. There's always that broken telephone. I'll explain something to you. You go explain to him. He hears something different. By the time we're going back and forth, he comes. We've had situations where a partner comes in really angry. Why did you put her on this medication? You're trying to destroy my partner. Then I'm like, what's the confusion? When we explain it, he sits and says, oh, okay. Lakini hukuniambia hivyo. Uliniambia hukuelewa sijui nini. So it helps to understand, and because you're a partnership, why not? You do everything else together, right?
Everything else.
So kuna kuanga na hii kitu yenye men wanasemanga, you know, hiyo kitu si ni the same to you know, hiyo kitu ni the same, like hiyo kitu ni the same, but we know.
Umeanza kuongea kama Mkenya. Hiyo kitu ni nini?
Kama vile maboyo ongea.
Quite a spade.
Vile maboyo ongea.
Okay.
Sema, hiyo kitu zinakuanga tu the same na kila mtu, but we know that is not the case, right?
Not true.
I'm going
Is
to want
it?
you to be more specific on that question.
Okay.
Like our bodies are definitely
Right,
different.
yes.
So
Yeah.
our vaginas are also different, right?
Yeah. So
depending on body
our
size, depending on vulvas
are different.
Vulvas are different.
So the vulva, again, there's external, internal. Internal is the vagina, and that's standard, pretty much standard for most women.
Okay.
But then the vulva is what will look different. What you see externally is different, and different is normal. Hakuna standard blueprint. This one is supposed to look like this for everyone, and it's an insecurity for a lot of girls and women, because if you Google, you find a certain type of picture, and then you look at yourself and you're like, mbona yangu haikai hivi? Yeah. And then it makes you feel like, I don't know why we lean towards it's me who's abnormal instead of thinking that's different. You know, the mentality.
Plus the pornography is also, right?
Yeah.
Plus,
It gives you a different idea.
I was told it looks like a flower, and the day I saw. And it's like I think it's also because of what is online for a very long time, even in school, because
From
of
the images they draw.
from the images they draw, also from the way the teachers explain, they never call it like what it is. For a very long time, I think until class 6, now you are like, this is because it's in the textbooks. But I think for a very long time, teachers walikuwa wanasema hiyo maua iko hapo chini ukioga, something like that. And then all through my mind, I grew up knowing it's a flower because I could touch and they're petals and it's a flower. Acha siku nilienda ku-explore. Nikaangalia kwa kioo, I was like, oh my God, what in the world?
Your flower iko
What in the world forest is down here?
Yeah.
You didn't see a flower?
It's a flower. What do you mean? But I think the understanding that, like, it's okay. You can have like large vulvas, you can have intakes, you can have small, all of that. I didn't have that knowledge until when I speak of later, I'm speaking of after like after school time, because it was also an insecurity to me. I'll be like, hey, kitu ni sura mbaya sana. But later I was like, so I can relate.
And you highlight one of the biggest issues we have with misnaming body parts. Because if you grow up as a kid with the wrong names, when you find, like, for you, your reality was, what is this thing?
Flower.
And you've not, we should just name parts for what they are. That way a child is able from a very beginning to conceptualize that this is what a normal body part is supposed to look like. When it comes now to the flower analogy, we say it like that because no two flowers look the same.
Yeah.
That's how it's supposed to be. Not that it looks like a flower. We use that analogy to mean a rose. If I give you a dozen roses, no two roses look the same, but they're all beautiful and they're all fine and they're all normal. And we appreciate the full dozen. So for women, you're not supposed to walk around thinking mine is abnormal, because when we were changing in school, I saw
Someone
this
else
and it
looks
looks different and this one looks different. When you're developing, again, if you think about those who go to boarding school, alafu you're all developing at different times, you'll be shocked. Mi sina nywele, what's going on? So if someone hasn't explained to you that even development is different for different women at different times, and the physical appearance is different, you should actually start to normalize that is normal. There's no abnormal. Unless there's an obvious issue that usually will cause symptoms, then that's when you come into the doctor and we're able to make a diagnosis.
Yeah, and I agree that, like, you should call the parts the way they're supposed to be called, so that by the time, I'm sure, nakuja na nakwambia, whether kuna kitu inafanyika, like, you know, my labia,
and you're actually able to tell me the specific part that is problematic.
Ni hapa tu, ebu angalia, right?
And then there shouldn't be shame around it either. When you come in to tell me, when you go to see the dentist, are you shy about telling them which tooth is hurting? Or ukienda kwa daktari general, useme my arm, it's this arm on this shoulder. So why is your breast a problem? Why is your vulva a problem? We put too much shame on those parts.
I think you should have. Do you have a song to sing like the parts? Like clitoris, vagina, vulva, labia.
We should have a nursery rhyme that we teach the exact
over and over again, but for adults.
Yeah, and I would like to ask also, because now we're speaking of difference and how different we are. And one thing I see we lack, I don't know if it's as Africans or Kenyans or just in home states, is the transition, like from girl to woman. You know, we don't have of course we can't have a manual, but at least for boys there's circumcision and then there's a whole education about it. And I just wanted to ask, like, what change have you seen that so many people have and don't realize it, that you've seen most patients walking and you're like, oh, this is like a problem to your vulva or like to your vagina?
In terms of problems, there'll usually be symptoms. So if you have, let's say you're not sure whether your vulva looks normal, if it's not painful, if there's no abnormal discharge, if it's not distorted or something looks, off, and there's sort of balance between the two sides, then you're okay. But something that's causing you pain, there's a swelling, there's a lot of itchiness or funny discharge, a funny smell. Those are the things now you need to know, okay, that's not normal. And which is why it's important to know what is normal. There are physical issues, like with development, like sometimes malformations, like during pregnancy. But those are picked up a lot of times when it's a baby, like at the baby phase, because your pediatrician, once akichukua mtoto, they'll examine fully and they'll pick up the issues. So majority of women, it's more an insecurity than an actual problem.
So what is normal and abnormal? I'd really like to know. Like when it comes to maybe the discharge, because you've spoken about that a lot. There's the discharge and then there is the itching and the swelling. Kwa sababu kuna ile tu kanywele kwamba mahali like acha nikatoe. And then there's that here, every 5 minutes unageuka kwa ukuta, you want to scratch something. And then also like for discharge, tunasikianga mara whether it's thick white or thin white, bora tu ni white, it's okay. So I'd really like to hear from you.
It's difficult to say that there's an obvious normal because we are all different.
Different, yeah.
None of us will be the same. The thing is it normal for you? That's the thing. So during your cycle, during the time of your period, immediately after, then ovulation, and then just before your period, your discharge changes a lot. So you know whether it's mucousy, it's thick, it's thinner, it's white, it's not, it's clear. You have your normal. Alafu harufu pia, you have your normal.
Yeah.
It's when those things change. That's when you know, and it changes, and it's not just a one-off. Nililala nikiwa ichi, nimeamka nikiwa ichi. Go see your doctor. Because you don't also see, it's not your job to chambua. Is this a problem or not? That's where we come in. So don't sit for 2 weeks saying, okay. Come in and check. Yeah, because again, we'll take swabs, we'll be able to make a diagnosis at that point.
Okay.
Alafu,
Just a minute.
It's okay.
But what is really abnormal? Because I don't want to miss that. Like, what is really abnormal? You really can't have this at all. Like, green discharge.
Okay.
There's
okay.
no way in this one.
Right,
green
okay.
discharge.
So with infections, then green discharge for sure, because that's more likely an STI. Frothy discharge, yani pali meketi inaanza kububble, because sometimes you get a discharge very watery, very bad smell, and then it bubbles on its own. So that's disturbing, and that's also abnormal. A thick discharge that's like yogurt ama cheese imegretiwa, like a very thick one that's sticking on the walls completely, that's also not normal. And then any smell, like fishy smell, a bad smell, a rotting smell, old blood kind of smells, none of that is normal.
Fishy smell.
Yeah, you can have there's a specific infection that gives you a fish odor.
I don't like when you use that statement because that is what men.
Yeah.
So, na huko kuna nuka samaki.
samaki.
Yeah.
Watu wafunge miguu, watu watambuka
Yeah.
skirts.
And even it's so
Nanukisha
bad.
gari.
Like, why do you guys do that?
Hey.
Huko kuna nuka tu samaki.
And even most content creators, tunaonanga wako like, it doesn't smell like flowers. It smells fishy. It has a smell. So
It
that
has
is
a
not
smell,
normal.
but
Yeah.
it's your normal smell.
It's your
maybe
body, it's
maybe
your
for
own
you,
scent,
your
right?
experience, that's the closest thing you can associate it and say, for me, it
Ni
smells
samaki.
kama
Like fish.
samaki. But that's not what we are saying. There's an obvious bad fish, like rotting fish smell, that there's an infection that smells like that.
I wanted to ask, what is your take on boric acid in terms of siju kukiwa hizo like discharge?
Stop immediately.
Stop immediately. With
Stop
immediate
with
effect.
do you do
immediate
with this?
effect.
I just know nilikuwa actually naangalia about hizo like odor na itchiness down there. So nikona wamenirecommendea something known as boric acid. I was actually looking to buy it, but
Boric
nijui tumekuwa na
acid ni
hii
dawa ya
session now.
mende. Let me put it into perspective
What?
for you.
For real? Kwani-
And the advice is put it inside, itasafisha,
Yeah.
nini, yeah.
First of all, that thing is not allowed douching.
Yeah, it's
called
not
douching.
allowed. Yeah,
What?
it's not.
Unless it's pessaries zenye umepatiwa.
Is in
Isn't
shock.
No, me, I'm still in shock.
You guys-
Damn.
Wallahi,
When will
It
they-
is.
Sio kudush, wallahi nimetumia boric acid. Why haven't seen
Umetumia?
not wallahi, but okay, I'll just give a small summary. So I had issues with my reproductive health, and not because of an STI at all. It was just pains, and it's not cramps. Like, pains will just happen. Not sure if they've gone away, but I've tried consulting with a few like gynecologists, and it came to a point where I was like, this is really disturbing, because there were so many symptoms that accompanied the pain. And again, it will get to a point where I could not walk, I could not stand up straight. And then me with my frustrations, and because now it's like I'm trying to talk to
desperation
people.
now.
Yeah, I'm trying to talk to people. I just feel like I'm not being understood, And again, finding like young, beautiful doctors like you. Yeah. I think it's I think it's also not like something you walk into every hospital
Every day.
and find. You find just men who are there and seated on the chair.
Old men, yeah.
All men. Yeah. And so I will explain to this guy now that gel anatumia when he's trying to examine the vulva, like the vagina, namwambia like it's irritating my skin. But ako like, he is irritated. He called it something. Ni maji tu sijui nini, you know. And it gets to a point, my frustration is what made me purchase boric acid. Yeah. Because, but one thing I tried to do, though I didn't find anywhere ni dawa ya mende,
Same.
I
Just
tried to
Google
read.
the chemical. itself.
Yeah, okay.
Yeah.
I tried to read online and look at reviews and look at some gynas have actually recommended it from what I saw online. And I tried to consult with one doctor. Akaniambia usitumie. But again, I felt like no one was really understanding my pain.
Yeah.
And no one was feeling what I was feeling. So I was like, kama nikudedi, acha nidedi. I went ahead and bought it and used it. I wouldn't say it changed anything, and that is where I'm like really surprised when you say that, because it's like at after kutumia, I still saw gyna.
Yeah.
Na nikamwambia, akaniambia, why did you? How can you explain? Yeah, like it's
It's actually a very dangerous compound. But
Yeah.
again, we've come from a place where we keep learning in medicine. Back in the day, there were some substances we used to use and we didn't know there were bad effects. So when you learn more about it, then you stop using it.
Yeah.
So I know there's a point in history where things like boric acid were being used. There were times, there was lead in everything before we found it's toxic to people. There are some medications that used to be prescribed.
It's like is it quinine? Nini ambayo ilistopishwa malaria?
Quinine.
Quinine,
But
sindio?
you need resistance. It doesn't work
it
anymore.
doesn't
work
It doesn't work
anymore.
anymore. So there are many chemicals along the historically that we used to use, and now even surgeries, we used to do surgery when you're wide awake, like you're held down by people. So medicine also evolves. But once we understand the dangers, it would be crazy for me to tell someone now use boric acid. Yeah.
And just speaking of boric acid, and I think the reason why I was forgetting this, the reason why I also went ahead for that is because I went for a high swab, and it was this sensitivity thing. There's a name to it.
The microscopy culture sensitivity.
Yeah, culture sensitivity, yeah. And I realized I developed resistance out of taking antibiotics a lot. And and also I realized this is so important, and I really wanted to talk on this because it's really important to follow up with one gyna at a time.
Yeah.
I messed myself up because I will see this gyna, not feel understood, move to the next one.
Yeah.
And that is where after I developed, I was getting like medication, a whole pack.
Different.
Yeah, I use, it doesn't help. I
Yeah.
move to the next one because I'm like, huyu hata anisaidii.
Yeah.
I go to the next one, ananipatia madawa, na feel, bado.
Bado.
Naenda kwa huyo mwingine, ananirecommend something totally different. Because the good thing, I used to go with my prescription. So every time angekuwa like, okay, but hii unaniambia pia, I'll give you this medication, but urudi. You see?
Yeah.
But I never used to go back because I thought they are the problem, not me. And after I developed this resistance, ndio nikakuwa like, boric restores pH, does this, that.
That's what they say.
So I really want you to talk on following up with a gyna at a time.
Yeah.
I know gyna hoeing.
I would actually say that one of the big challenges ni vile umesema, not understanding that medication takes time to work and then there's a follow-up after, because I need to know, because sometimes whatever you have is either resistant or the medication was not effective, or sometimes it's actually the delivery, I give you instructions on how to use it, but ile magic unaenda home unafanya different stories. So there's usually, majority of times you'll be told come back in 2 weeks or come back in a week's time. That visit is more important than this first one because I get more information on how you're doing from the treatment. Sa shida ni, I give you a prescription, you expect magic cure immediately, you only take, in fact, you take for 3 days, you feel better, you stop, which is even worse, right? And then you forget about it. You don't come back for follow-up, hukumaliza dawa. Next time your shida ikikuja, you go to someone else. They don't have the history of what we did. They don't understand what we were treating for. You come and tell me a red tablet and a capsule and I'm like,
Red
So
yeah.
that's the standard that we see. So when that happens, what you're going to do is you're going to help doctors and we're going to mix medications and resistance will happen because the bacteria or the fungal cells are learning how to fight and survive from this medication that you keep giving. So you need to follow up. It's so important to follow up. When you're given a repeat appointment, come back. It's not a waste of time. Sometimes you have such a bad infection that we need to repeat swabs and make sure we've cleared it. And if it's not cleared, we put you on different medication immediately. So it's so important to follow up with your appointments.
Dr. Claire, what do you think are some of the issues ambazo young people ambao wanakuja kwako they face that you think we should address hapa kwa podcast yetu?
I feel like the biggest challenge the youth have, and mostly it's it's propagated, it's generational, it's our big problem, and I'll keep emphasizing, is lack of education, lack of information. So you just don't know what is right, what is wrong, what should I do now, what should I do next. Alafu tunaulizana, and now
Misinformation, right?
exactly, and then now we have the internet, and the internet, depending on what you search for, you'll find the answer for the one what you're looking for. The way you bias the question, me, I want to be told boric acid works, so I'll only get results that boric acid works.
Wow.
If me, I'm looking for the bad side of boric acid, I'll only find the bad side. If I'm looking for, so it depends on how you even ask the question on Google. So one of the biggest challenges we have with the youth is lack of information. And because of that, then you end up with a lot of people who are engaging in very risky sexual behavior, unprotected. So then STIs are on a massive rise. We're treating STIs now at a much younger age than we used to before.
What is the youngest? Sorry, what is the youngest you've treated?
Teens. The teens.
10, 19.
13.
Earlier teens.
13, 14.
Somewhere there.
Okay.
Yeah, so it's becoming such a problem area. And then because we're also having a lot of intergenerational relationships, so where you would think that an infection should be seen, or the majority of people at this age group, unapata, inaingia the young people as well. So those are the things that I think people need a lot more education and information, because again, if I don't understand that I can say yes or no, if I have a partner and he's insisting we won't use a condom, then mine should be a hard no and we move away. Like we move on. It's not something we force me into doing. But because I don't understand that I can say yes or no, I don't understand my body is mine and consent is for me to give, I'll go ahead and do what he asks. And then I end up with the repercussions. The other thing is we don't have information or access to contraception. A lot of young people are not ready to be parents, but we're talking about abstain. And you're not taught anything else, right?
We are pretending that they're not engaging in sexual...
And I'll always say there's nothing wrong with abstaining if that's what you've chosen to do. But if you choose not to abstain, you should have information about how to be safe, so that you don't have pregnancies. Because now we're losing a lot of young women to botched or unsafe abortions in the country. That's another big issue that we are having. And it's because she's desperate. I didn't know. In fact, the ones that I've seen tell me, I didn't know I can get pregnant standing up, if we had sex standing up. I didn't know I can get pregnant if I washed myself. I was told to wash myself after with Coca-Cola, na sitapata mimba, or I won't get an STI. Or the one now where we were taught about pre-cum. Most people don't know. So you think because he didn't ejaculate, he didn't come inside, then I'm not going to get pregnant. And then you're pregnant after. So when we have, it's just lack of information puts people in such a bad situation. And then, of course, there's lack of resources and access to services. Resources makes it easy for young people to be exploited, so that sex becomes transactional. Ndio upate hii, utanipea hii. Ndio upate hivi. And unfortunately, especially in the rural areas, in the impoverished urban areas, it's actually not transactional at ya pesa. It's for pads, it's for water, it's for access to the basics, it's for food, it's for keeping the family alive. So now you're forced to have sex with somebody, some old person who's, probably even known to be infected with HIV or something like that, but you have to put yourself at risk. So we have left our youth in a space where you're so vulnerable to be exploited, and we're just refusing to teach you how to keep yourselves safe. So I think if we were to be able to centralize information, and that's why I like Wazi so much, like you can ask a question. You don't have to end up in a place where I didn't know and I don't know who to talk to and I'm ashamed. I can't afford the doctor yet, or I don't know which doctor to go to. Start a conversation there, because if you have access to the information, you're even able to make better decisions. Don't you guys think so? Like now that you know better, of course you end up doing better.
So umesema Nairobi mpoa wako wako na syphilis, permanent wako wako na gonorrhea. The STIs are on the rise, eh?
They really are.
Guys.
They really are. Silence.
Goodness.
Like a moment of silence for the fallen soul.
And then you see it's across generations. It's not just a niao, like the older generation, because they're spreading.
Because again, when you're young, you feel you're very indestructible. So you don't think you can get an STI, you don't think you can get pregnant, you don't think, it catches you by surprise. And yet, ukona an older partner who, of course, is taking advantage of the fact that you don't know, and they're not going to tell you. that they have a diagnosis. They're not going to tell you
Of
because
course.
you don't know they're
Of
supposed to tell
course.
you. You don't know that
Yeah.
you're supposed to disclose an STI if you have one and tell any partners you have that so they come for treatment, for testing and treatment. They won't tell you.
I have a question before we wrap up.
Yeah.
So, I'm on contraception, yeah? Higher. Alafu, let's say with my partner, we can get the HIV testing kits. Tumefanya. So tufanye. But sa niaje? Tulisema tutapima. Tupime. But then that still doesn't make me safe.
At all.
How do you in that situation, how do you get to know about if he has an STI or not, or if she has an STI or not?
Go in for testing and go in for testing together. Don't believe me when I email you results.
Yeah.
Go in for testing. And we do, again, that's a service we offer when you come in for your sexual health checks, your wellness checks. STI screening is something that's done, and it's screening. The aim is to keep checking to make sure you don't have or you keep yourself safe. Sometimes I find that those people who come in regularly, especially if you have more high-risk sexual behavior, multiple partners and the likes, you're testing more regularly. So we advise every 3 months.
Yeah.
And of course, hopefully keep using protection because if you have multiple partners, you should be keeping yourself safe. But get tested so that you're sure. A lot of the people who know their status protect their status. If I know I don't have an STI, I don't have HIV, I am safe, I'm not going to go and allow you to just do what you want.
Yes.
True or false?
Yes.
Right?
Yes.
See, kama mwenye,
Yes,
I believe.
sindio?
Yeah.
Yeah.
You just, if you know and you're able to empower yourself and you go in with your partner, both of you tend to become a bit more responsible even with each other. So it's that thing of let's not know, we don't care. That's where that puts us at high risk.
True.
Yeah.
So akunanga kits, akuna self-testing kits for
The
STIs.
No, because again, there are many different STIs and the
Yeah.
tests are different.
Different.
Yeah.
Okay.
Sometimes,
So for that,
sometimes need damu, sometimes need swabs, need discharge,
Urine,
those kind
yeah.
urine. So you'll have different types of samples.
Okay.
Yeah.
Doctor, I'd also like to seek clarity on a matter. Herpes ni STI.
Herpes ni STI.
Niko na swali on that. Kuna kwanga na hii notion. Sijui kama ni notion nataka tu univerify. Sisi girls tunapenda ku apply lip gloss. And then kuna mtu nilisikia akisema pale TikTok ati alitumia lip gloss akashare out when you go like clubbing out with friends, you're the only one with the lip gloss, wanakuomba you just give them, kila mtu ana apply directly onto their lips from the applicator thing. Na akasema after some time akapata herpes, like hizo sores on the mouth. So niko zile za yani hiyo herpes ambayo bado ni stay, bado ndio herpes inakuja kwa midomo za watu.
Okay, that's a very good question. So there are two types of herpes.
Okay.
There's type 1 and type 2. Type 1 is oral. Ya mdomo na ni most commonly unaonanga ka cold sores. Ukipata homa unapata watu wanapata kidonda kwa mdomo. Then type 2 is genital. So the one that's considered sexually transmitted, usually we're talking about the genital herpes. But then this other one is, again, herpes is a virus, so contact is the thing that will transmit. That's why ukijipaka ama ukitumia product na mimi natumia, I'll also transmit it from one person to another. Yeah. So it's usually that if there's the sore ama something, an open wound and then it's leaking the virus, if I use something you've used, I'll end up with that same infection. But there are those two types of herpes, just to clarify.
Yeah, asante.
Anyway, hao watu wamekuuliza maswali nyingi sana. Free consultation.
Free consultation today.
Wale watu ambao wanafaa kuja kulipa. Please tell them wanakupata wapi na ni pesa ngapi.
So my clinic is in Upper Hill,
Okay.
Mayfair Center, first floor. We're called Prime Care Health Services, and consultation is 4K, but we take most insurances. So kama uko na insurance, we're able to cover. Then I'm a host of a podcast. Like I said, I'm very, very open with information. So check it out. That's Circling the Rabbit Hole podcast on YouTube and every other audio platform. Yeah.
And the gym, you can find her. Like, daktari, a quick one. Wale ambao umeenda na hii gym, what do you gym, baby?
It's not for the
Wale mnamuona.
Sitaki kwenda kusign autographs badala ya kuwaka.
You see at the gym, you never know what someone else does.
Yeah, true.
So now, guys, this is the face. Daktari, a quick one. This is her. All right. Thank you so much for joining us.
Thank you for having me. You guys have been fantastic. And I hope because we've had such a good conversation, people have learned so much as well.
Yes.
Yeah.
because that's always what we try and do here. Like we are learning.
learning.
Because it's just conversations as we learn.
Yeah.
And people also, you know, wanatuuliza, zile hatujui,
Yeah.
we direct everything to Wazi.
Yeah.
Nice.
All right, guys. So that's all we had today on this particular episode. Yes, Space Yako, the podcast. Kumbuka unatupata across our social media pages at Wazi. Alafu pia pale katika website yetu ni wazi.ke. USSD kama pia unataka kutumia, I mean, why not? Just dial *709#. Alafu unapata kuchat. So I told you, I gave you a challenge today. Sawa? Apart from kwenda pale katika website, nataka uchat. Just say hi. Hi dear, hello, hello, sawa, and then you see the messages that zita prompt hapo, sawa. And of course, Dr. Claire amesema you're welcome to visit her. Amewapatia information, so feel free to go.
Karibuni, I'm happy to continue the conversation.
Sindio?
Yeah.
And I hope that you come here next time as well.
I'm waiting for an invitation.
Yes, kuja. Hata usingoje, kuja tu. Si utatupata tu hapa. Guys, that's all we had. Bye guys.